Hello everyone, my name is Enrique and I'm a digital health scientist at SilverCloud Health, and I've prepared this presentation in collaboration with my colleagues Jorge Palacios and Derek Richards. First of all, I'd like to thank Dr. Becky Inster for inviting us to this conference on digital innovation in mental health. And on this presentation, we're going to talk to some of the responses that our organization SilverCloud Health has given in response to the COVID-19 pandemic. In regards to the agenda, I will briefly introduce what SilverCloud is, how do we operate, and focusing on the particularities that have changed due to the current situation. Then I will also present some of the actions that we have given in response to the COVID-19 pandemic. And my colleague Jorge Palacios will discuss some of the data and the insights that we have observed in the past number of months, some of the challenges and limitations of the current data, and to conclude with some future directions. In regards to the introduction, what is SilverCloud? Well, SilverCloud is a digital mental health and well-being platform that delivers evidence-based internet-delivered psychological interventions. We operate in different countries and settings across Europe and North America, and SilverCloud is offered as an end-to-end solution that allows direct access to different devices, and once the users sign up, usually they are assessed, and depending on their level of needs, they can be offered different modalities of support. Then, depending on the type of needs, they can be allocated and assigned to one of the different programs that we have on the platform. At a service level, at a clinician level, they can also monitor the symptomology and the progress of the users over time. As I said, SilverCloud is composed of more than 30 programs, and we cover the entire spectrum of care, from well-being and preventative interventions like space for resilience, for sleep, and space from stress, to more treatment interventions like space from depression, space from anxiety and the different anxiety presentations, and at a more tertiary level for individuals with chronic conditions. SilverCloud can be offered in 3 different modalities, one of them being self-help mode, where the intervention is offered in an unsupported manner. And here, the aim of the intervention is basically to promote positive mental health and well-being for individuals who are in the lower end of symptoms. SilverCloud has been mostly offered as a supported intervention. The support is offered usually by a professional, a clinician, who has been trained in the delivery of low-intensity intervention, and the main role of the clinician is to keep the user engaged and motivated, providing feedback through the platform so that the user can continue using it over time. We have also been used within blended care models, where SilverCloud is used as an adjunct to existing treatments, and usually this is the type of services that are provided when patients have a more complex needs or are at a more severe level, and where the clinician needs to be more present. Within healthcare settings, SilverCloud can be used in different modalities as well. Usually has been mostly used as a standalone intervention for individuals with mild to moderate presentations of depression and anxiety, and offered with support. However, in the current situation with the pandemic, we have observed an increase of use of the intervention in the unsupported model and also the blended model. But you can see here that we also the intervention has also been used as a waiting list initiative for individuals who are waiting for face-to-face therapy, or also in the discharge care planning of individuals who have gone through inpatient services. Outside of the healthcare settings, SilverCloud has also been used by universities and different public and private organizations. And I'm focused on this as well because my colleague Jorge will introduce as well some of the data we have observed in regards to this. And we have been used actually by some large organizations who have offered the intervention by doing nationwide rollouts of the preventative suite of interventions. It is important to mention that SilverCloud is compliant with the highest standards of security and privacy, and also SilverCloud is a recommended treatment by clinical guidelines like the NICE guidelines in the UK. In regards to the actions and insights that we have taken in response to this situation, first of all, we developed new content that could resonate with people in regards to the new situation that they were facing. And for this, we developed content based on the principles for intervention development during emergencies. This is based on 5 principles, which is creating a sense of safety, a sense of calmness, a sense of self-efficacy and collective efficacy, a sense of connectedness, and a sense of hope. All this with a goal to provide individuals with psychoeducation and key strategies to support their mental health at a time of crisis. We developed this as a module that could be incorporated into our existing interventions, especially stress, resilience, and well-being, stress, resilience, and sleep, that were the ones that are going to be mostly used in this situation. We also include this challenging times module in the form of a program covering the different needs that we have observed, like sleep problems and also trauma and different stressors. The first action we took as well was to offer SilverCloud to frontline and healthcare workers that have been affected hugely and massively by this situation. The levels of depression, anxiety, and stress has increased significantly in this population. So, based on this situation, we offer our preventative suite of interventions, space for stress, for sleep, and for resilience. With the COVID-19 module, we offered it to healthcare staff in Ireland and in the UK. And here you can see the numbers. In Ireland, more than 2,100 participant healthcare staff used the intervention, the different programs. And then in the UK, you can see that more than 6,500 participants signed up into the platform and were using the different programs. Similarly, and outside of the healthcare settings, some of the organizations we work with also took the intervention and offered it at a nation level. We're talking about Express Scripts, which is the largest pharmacy benefit management organization in the United States, who made our programs of sleep, resilience, and stress available to all their customers. And also Shoppers Drug Mart, which is the largest Canadian retail pharmacy chain, also offered the intervention nationwide. So here, with these 2 efforts, we were covering more than 100 million lives. So this is a huge action that was taken by some of the services. Of course, we have not gone up to a mountain to claim what we do. We only went to our services and we asked the question how we can help. And these are some of the actions that we took. From here, now my colleague Jorge Palacios will continue presenting some of the other actions that we have taken, as well with some of the insights that we have observed. Thank you very much.
Thank you, Ángel. Indeed, I am now going to share with you some of the insights and the data trends that we have seen in the past few months. And certainly in comparison to what we were seeing at the beginning of the year, pre-COVID, if you will, and with respect to years past, we've tried to look at our data in a lens of, navigating the uncertainty and the ever-changing quality of the evidence. This is certainly a unique situation, and it's hard to tell if what we're seeing now will be true in the coming months, but it's still very useful to look at some of the data, and then obviously in collaboration with what all of you are seeing, just try and build a complete picture. So just going to illustrate some data points for you. Starting with this one. So if we look at the UK, where still the largest percentage of our clients and customer base users are located. If you look at the 4 largest services which operate in England, in NHS England, and actually are represent the 4 corners of England, northeast, southeast, northwest, and southwest. You'll notice that the users in January, February were relatively stable, but then there was a spike in March that also continued into April. It has tailed off slightly, so the number of users are more or less back to pre-COVID levels, but not quite. So we think we're going to see kind of a new baseline for the number of users. come into the platform, obviously in addition to growing services as well. So the total numbers will certainly increase, but that's why it's useful to look at individual services to see kind of those trends in places where we've operated for a while. And so they really reflect what was happening behind the scenes. If we look at the US, for example, in particular, the users of the COVID-19 program, that spike, that April spike is very, very stark. So the number of users of the COVID program, that's not to say the module, which also obviously a lot of people have used, but the standalone program, April, which is right around the time when lockdown happened and the vast majority of cases started happening, and really the pandemic really started to dominate the news cycle. That's when we had most of the users. And again, that carried on into May. June saw a little bit less, and July we're only now waiting for the numbers just to see how that trend has continued or shifted. Something really interesting is that whilst we offer, both supported and unsupported models, like Enrique was saying before, so coached or uncoached, historically, the majority of our users have used the coached models and the supported models. So if you see the percentage distribution of how many are unsupported versus how many are supported in this chart here, you'll see that January, February, which also kind of continued the trend for 2019, the vast majority, so around 70% of users were supported. But what happened in March and April and into May and June is, a complete turnaround of that distribution. So now the majority of users we have in the US, at least for March, April, May, were unsupported. And now that's kind of balanced out. So we have about half and half supported and unsupported users. So there's obviously a really large shift into people using the platform on their own, walking through the modules on their own with similar effective results. And in the UK, obviously we've got much larger numbers in the UK of users as of yet. So the shift in percentages won't be as dramatic just because, we've got larger numbers. But still, usually about 1 in 5 would have been unsupported. But in April, this climbed just overnight, if you will, to 43.8%, and that maintained in May to 45%. June, it's still around 40%. So that's still twice what it was in January and February. So a lot more people are using the platform in an unsupported capacity, which is very, very interesting and something we need to adapt to. And this is likely going to be the case for the next few months. Some qualitative insights as well, meaning, okay, what are we hearing on the ground? What are the murmurs? Well, on the one hand, there's an increased reliance in digital in our platform. Some services have closed and have transitioned temporarily to just offering online support because they can't offer face-to-face. But, this has also coincided with a better acceptance. So there's much more buy-in with managers and supporters. They see the value, certainly, and just, the need for these types of interventions that offer treatments remotely. However, we haven't seen a significant change in entry-level depression and anxiety scores, meaning that the symptoms of, our users are still, more or less the same when they start. And this is obviously anecdotal, but also backed up by the analysis of our data, filtering it by program, by service, by geographic location. There really hasn't been much of a change in terms of the symptomatology when they start. Now, some of the limitations and challenges that we can see and discuss as well. Obviously, unique service characteristics should be taken into account. This is true outside of the pandemic as well, but obviously there's a lot of procedures in terms of the implementation and the onboarding and the types of program used that will make a service, unique in how it responds and what type of severity the users have and how they perform, how they engage. And these are really important in times like the pandemic, where you have different spikes in different areas, where some areas are, experiencing perhaps a second wave, some areas are going back into lockdown, the levels of unemployment are different, and that just creates anxieties that really change from place to place. And this is at the country level as well. I mean, obviously they're experiencing the pandemic at different stages. That's certainly the true for the US versus the UK versus Canada, Ireland, all of the countries where we're involved with. So this whole situation translates to many unmeasurable factors behind the scenes, which we really need to take into account when we are offering this service. It's a constantly evolving situation. As I said in the beginning, changes may not necessarily reflect what's coming. So that's also a challenge. However, thinking of future directions, well, of course, the mental health needs of the population and the individual will change over time. And as such, the content of the programs should adapt in line. So, you might have higher anxiety in this coming tsunami of mental health attached to money worries and unemployment. But we can build programs. We are building programs for money worries or modules that are attached to these kind of scenarios. The self-management of chronic conditions will be crucial. The reports of people not getting enough cancer treatment during the pandemic or not going to the doctor, this will create, more severity, more morbidity in people with things like diabetes and heart disease. And we have programs that self-manage symptoms of depression, so help with the self-management of these conditions, but also help deal with the symptoms of depression and anxiety. The good thing about having a digital online platform is that it allows for rapid development of new content. And the case of COVID-19 was exemplary in the sense that we realized we had to produce a module that helped people in this current situation. We produced an entire program. Obviously it became a priority and it was done. It was rolled out for free, like Uncle was saying. And now we can, study it and study the effects and really be better prepared for a second wave, for a future pandemic, etc., that affect collective mental health. In line with what we learn from our colleagues and what we learn from each other, digital mental health can certainly help pave the way for a better future in terms of addressing these important issues for the population at large. Thank you very much.